Discuss whether healthcare in the UK should be provided by the government or the private sector. Now, this question is also interesting because it's not your typical your question where you take a look at something to correct market failure, but it's kind of like vaguely disguised, this question. So I like the way the student has answered this. So I'm gonna read you through it, tell you what I like about it, and why I really enjoyed reading this specific essay. And I'm going to give a little bit of commentary to add to the context. All right, so it is debatable as to whether healthcare in the UK should be provided by the government or the private sector. If healthcare were to be provided by the government, it would mean that the taxes paid by UK citizens would be used to finance healthcare, and then it would be provided for free. However, if healthcare were to be provided by the private sector, it would mean that it would only be paid for as and when it is needed, and that the private business would receive all the income. Healthcare is American, as it has more benefits than consumers realize. For example, an individual having good healthcare means that they are physically able to work, and hence contribute to the economy. However, it could be argued that healthcare is not American, as when someone is receiving healthcare, they are not working, which results in a less effective society. Healthcare has several positive externalities. For example, if an individual receives health treatment, it prevents the spread of disease to the rest of society. Very strong introduction, very well written, going through the explanation of how healthcare is provided by the government and what would happen if it were provided privately. Now, I expect both of these arguments to be analyzed within the essay, and I really want to see if they take this point further about healthcare not being American, because that argument doesn't really hold much weight, but I think the author introduces that discussion on purpose. It can be argued that healthcare in the UK should be provided by the government. If the government provided healthcare, it would be freely available in an unlimited supply, which would mean that people are more likely to consume it. The only criticism I have here is that if the government provides healthcare, it's not going to be freely available in an unlimited supply. Really, I think taking that term unlimited is really stretching your understanding of how freely available it would be. Right? Nothing's unlimited in supply. It may appear to be so, but not in reality. Right? That's a study of economics. It's scarce. So, unless we could say maybe less restricted supply. This means that there will be an improvement in society due to an increase in positive externalities, where more healthcare will result in more citizens being able to work and hence contribute to the economy. Excellent. You could even push that a little bit further, saying that since they're working, they're paying more tax, which then, just talk about that kind of cycle. However, if the government were to provide healthcare, it would be a public good, meaning it has a feature of non-excludability, meaning that it's impossible to prevent people from enjoying the product even if they have not paid for it, meaning that it is unfair on the UK citizens who have contributed to the costs. Fair enough, right? We have the free rider problem, saying that some people who have paid for it will be paying for those who have not at all paid for it. And, we've heard this debate over and over. That's not going to stop, but it's an excellent point to bring up in this essay. Furthermore, the fact that it is a free product means that it could be taken advantage of, that people could consume the doctor's time and medicine even if it is not necessary, therefore wasting the resources and the taxpayers' money. Excellent point. In addition, the free healthcare may result in increased demand, which is beyond the capability of the system to deal with. But therefore, the services to the individual will be less efficient, therefore minimizing positive externalities of the service. Wonderful analysis. Right, and that last sentence is ultimately what the huge debate is today about the NHS. So this student really shows their understanding of the system. On the other hand, one can argue that healthcare should be paid for by the private sector. An advantage of this system is that it means healthcare is only paid for by the people who need it, and it's not a public good, meaning that UK citizens are not paying money towards causes which will not directly benefit them. Additionally, if people are aware they will have to pay for healthcare, it will give them an incentive to look after their health in order to prevent healthcare bills. True. Or this is arguable. But, well, that's another discussion for another day. Also, less demand for private sector provision of healthcare results in a more efficient service. However, the cost of this is that less demand will result in underconsumption, as the consumption of the good will not be socially optimal. This can be shown on the graph below. PQ represents market equilibrium at the chosen level, where marginal private benefit equals marginal private costs. However, P1Q1 is a socially optimum level, where MSB is equal to MSC. That's excellent analysis, good introduction of the diagram, and a really good explanation of why it might be better in the private system. In conclusion, the best solution would be a combination of both the private sector and the government provision of healthcare. which is the system that exists today. In Britain, the private sector exists and provides what the public sector cannot. The effectiveness of the public sector depends upon the attitude of the government and how much money they are willing to intervene. If the government did not invest a lot of money into the healthcare system, it would mean that there would be limited positive externalities, and therefore private sector would be a better system, as a price would ensure an efficient system. Additionally, it is likely that a government provision of healthcare would not be sustainable, as a free provision would mean that the service is taken advantage of and therefore would limit resources. Good point addressing here at sustainability. However, the availability of the private sector provides UK citizens with an opportunity to opt for a more efficient service than the current government provision. I like this evaluation. It talks about the attitude of the government. How effective it's going to be will depend upon how much money they want to spend. And if they were limiting how much they would put money in, then it'd be better to have a private system. But this is good because you talk about here that doing the completely free provision kind of shuts out those people who would be affected by the, I'd say, the limited efficiency in the free riders. So an acceptable evaluation, leaning towards good. So let's go through the levels and see how they did. So level 1, I'm going to give them good use of knowledge and demonstrated understanding of key terms such as public goods, merit goods, positive externalities, scarcity, and negative externalities. Strong application to healthcare throughout. That's clear as day. Balanced approach, pros and cons. We saw that with diagrams. And the sound evaluation, looking at the effectiveness of each method, and a final judgment suggesting the best solution is a combination. All right, if I'm being picky, I could ask for further evaluation into the opportunity cost of government spending. How far does the private sector go in the UK? But this is a F581 paper. Looking at this essay here, I'm very happy with the way it was written. And it's 17 out of 18 if I wanted to be tough. Right? If I wanted to be tough, it'd be 17 out of 18. But ultimately a very strong essay and a great approach to it.